Thank you. My question is to Mr. Ge Minghua with Xinhua News Agency. Since the outbreak of the epidemic, for the medical workers, they are protecting the health of our people. So you are actually retrieved from the front line from the last group. So can you share with us some of your experience in fighting the pandemic? First of all, thank you for your attention and concern for the medical workers. So my name is Ge Minghua. I work in the hospital and as a doctor in the Zhejiang Provincial People's Hospital. Right now, the epidemic situation remains complex with the strong leadership of the CPC Central Committee and China's contribution to fight the epidemic impress the world. We always put people as our first priority, and also we demonstrate the strength of China to the world. And for some of the people that always fight at the front line, when there is an outbreak of the epidemic, these people will be engaged to treat the patients, and also they will engage themselves in the nucleic acid testing. It reminds me with the fight in 2021 in Hubei province. At that time, I led a delegation and worked in the CCM areas in Hubei province. And for our medical workers, they enter into the isolated areas and do what they can to treat the patients. After the mission, and some of the medical workers, they decided to stay in the city of Wuhan. And in the end, we come to the Zhejiang hospital in Wuhan, where there were many severe patients. And also for our delegation, we actually leave Wuhan as the last group of medical teams. And there's no death during our service. So during our fight against the pandemic, we never feared the difficulties and challenges. Even though right now it is in a routine situation of the epidemic prevention and control, and in the Spring Festival, we found there is an outbreak in one of the cities of Zhejiang province, and once again, I led a team to work on the nucleic acid testing. We received the instruction on the New Year's Eve, and we immediately formed a team and collect all the medical supplies. And we, on average, slept only like 3 to 4 hours per day. And especially during the Spring Festival, the weather is very cold, and for NAT sample collectors, they have to wake up very early, and they have to stay in the NAT testing site for many hours. And many people, they feel very cold during the work. However, we expedite our nucleic acid testing capacities and are able to release the results as soon as possible. Just within a few days, we're able to bring normal life back to the local people. And so right now, I think for all of the Chinese residents, they have to remain vigilant. We have to safeguard the achievement that has been hard-won. After I returned from Wuhan city, they asked me why I decided to go to Wuhan. I said, I'm not fighting for my personal interest. I want to serve our people and serve the country. I believe this is the original aspiration for all the medical workers in China. Thank you.